Right now on KCCI, one-on-one with Governor Kim Reynolds. Eric Hansen sits down for an exclusive interview at the State House, how she rates the coronavirus vaccine distribution in Iowa, and her reaction to legislation that would shorten early voting in the state. Close Up starts right now.
This is Iowa's news leader. This is KCCI 8 News Close Up.
Good morning and thank you for joining us. I'm Scott Carpenter. One-on-one with Governor Reynolds. This morning we're bringing you an exclusive interview with the governor from the State House. We covered a number of topics in our discussion, including her administration's response to the pandemic. KCCI's Eric Hansen asked the governor about the coronavirus vaccine distribution in Iowa. She says more doses are on the way.
The biggest question we have gotten right now over the last couple of weeks is, how are we going to get our vaccines? You can't wave a magic wand and make more vaccines appear, but what can you and the state do to get more vaccines in more arms?
Yeah, well, it's still based on the federal allocation, and on the White House call that we had this week, it's still based on population. But they are increasing week over week. They have guaranteed us that what we're getting now, we can count on at least that minimum for the next 3 weeks. We've asked for them to extend that at least to a 5 or 6 week timeline so that I can provide that certainty to our providers that are vaccinating Iowans across the state. It's going to be helpful. Johnson & Johnson, I think, is projected to come on the 1st of March, so it'll be a slower rollout, but they've got some pretty good numbers that they're going to be able to add to the mix. I'm happy to announce that our retail pharmacies that are getting 10,000 will get their allotment almost doubled for next week, so that's movement in the right direction. So we're making progress. We've upped our ability to get Iowans vaccinated. We're 21st now based on what's been distributed and what we've been able to get in the arms of Iowans. And so we'll continue to improve the process and continue to advocate for more vaccines really running through the state so that we can really help disseminate them in a manner that can get the majority of Iowans vaccinated. But it is just a supply issue, and until they're able to manufacture more, every single state is going through the same thing that Iowans are going through, and so we're going to continue to work through that, and when we get extra vaccines, we'll get those administered.
There are so many questions about who gets what shot first and why. That Infectious Disease Advisory Council made a lot of those decisions, but we haven't heard a lot about the whys behind them. Describe why things are ordered the way that they are.
Yeah, well, a lot of it from the very beginning, we've said that those that are most impacted by COVID-19 are our elderly population and those with underlying conditions. And so I think what you saw was most states really moved to focusing on our elderly population, and so Iowa did the same thing. We went to 65 and up, but one of our #1 priorities that was in 1A that was really, really critical was making sure that we got our loved ones that are in our long-term care nursing home facilities and assisted living. And so by the end of February, we'll have all of the residents that wanted it and staff in our long-term care and assisted living facilities will have completed their second dose. So that's really important, and I think, you know, that's one of the reasons too that we're seeing our long-term care outbreaks just continue to go down. Right now we're almost 83% lower than we were at the peak when we had just a significant amount. 166, I think, was our peak of long-term care facilities that were in outbreak status. So that'll really, that's comforting to know that they will have their vaccine, and hopefully that will allow them to get together with their loved ones too, so that will start to change some of those dynamics and how we can visit with the loved ones that are in our nursing home facilities.
The Biden administration's been in place for about a month now. Describe your relationship working with the federal government over the last month. How has it changed?
Well, so far my interaction mostly has been with the vaccine. They continue to do the weekly call with governors all across the country. That's what the Trump administration had done as well. I find that very helpful because it does allow us an opportunity to get the latest information, what their projections are, to really be vocal about some of the things we were concerned about. I was not the only governor that was concerned with the long-term care rollout. That really was impacting what perceived to be are not getting vaccines out in a timely manner, but we didn't have any control over the long-term care rollout. And so I appreciate the opportunity to get the information and to ask questions with my other colleagues. That's been helpful. So that's probably the biggest area that we've been working on. You know, I'm really watching very closely the CARES whatever number we're at right now. Iowa has been a state that, our fiscal health was strong going into the pandemic, which allowed us to weather a lot of the COVID-related issues. We kept over 80% of our economy open, and we have had our kids in school since August for the most part safely and responsibly. And so we're in a good place. We've got our cash reserves are full. We have a healthy surplus. We've invested in education. We're talking broadband. So at 1.3 trillion is a lot to pass on to our great grandkids, and so that's one of the things I think we'll continue to be vocal about, is we just need to be mindful. There are businesses and areas where absolutely we need some help with CARES funding, but I think it needs to be narrow in scope, and we need to take a look at where we're at. The map looks a lot different than it did in November, when almost the entire country was red with experiencing surges with COVID-19.
It's been about a year since you've started making some really tough decisions for the state of Iowa. Describe what the decisions that you made that you're most proud of, the decisions early on that you and the state carried out that you're really proud of what you did in the last year.
Well, first of all, I got an incredible team, so I just cannot say enough about how hard every one of the agencies have worked to really coordinate and communicate on behalf of Iowans. I'm really proud of what our health care and clinics and hospitals have been able to do over the last year. The coordination, the communication of competing entities to come together and serve Iowans. We didn't know when we began this how many vents or ICU beds we really had available, and so to be able to put that system together, to be able to assure Iowans that here's what's being utilized, here's the beds that we have available, we're not going to overwhelm our healthcare system because we know what resources we have and where we need to respond and react. Probably one of the things I feel really good about is our ability to access testing. It was a nightmare at the beginning. Every single governor was looking for reagents and agents and the ability to test, to understand really the spread and what COVID-19, the impact that it potentially could have. And we were able to secure 540,000 tests and a data system that really allowed us to track the spread down to a zip code and to better understand that. And it really allowed me to go into our processing facilities and really make sure that we were providing the tests that they needed so that the employees felt safe and that we could keep the food supply chain up and going, which is important because in Iowa we feed and fuel the world, and so we have a very important role to play in that process. And that ability to not only provide the PCR testing but the serology testing and really start to understand what was happening with COVID-19 was pivotal.
We don't get do-overs, but we do have opportunities to learn from our past. What if you could have a do-over on a policy, what would you change over the last year? What decision you made?
At the beginning, we just knew so little about it. It was unprecedented, and the projections, the early projections were just horrific on what the potential was for hospitalizations and deaths and positive numbers. So, early on in March, we closed the schools, and I don't know if I would have known then what I know now and actually where we were at with COVID-19. I mean, that seems like a small thing, but it really wasn't. I think I probably would have maybe been a little bit more mindful of that. I've tried really hard to strike a balance to not only do everything I could to protect the lives, but the livelihoods of Iowans as well, and to really to manage and preserve our healthcare resources. And so because of that, I think we are in a better shape than a lot of other states because of those decisions. But we always learn. I mean, we've learned every day. It's changed every day. At the beginning, remember, they thought that you could get it from the cardboard boxes or from the groceries that you got at the grocery store. And so every day we learned a little bit more, and I hope we've tried to adapt and adjust based on the information that we had.
Up next, school funding and the additional help on the way for districts dealing with COVID-19. Our one-on-one with Governor Reynolds continues next.
Get the thrill of the drive and exceptional savings.
Welcome back to Close Up. Local control during the pandemic. KCCI's Eric Hansen asked the governor about letting Iowa leaders make decisions for their communities.
The president gave you a lot of latitude as governors across the state to make your own decisions as opposed to sweeping, nationwide policies. Did that help you that you weren't under the same restrictions, the same umbrella policies as California and New York, or do you wish you would have had a little bit more federal guidance?
No, because I said every state is different. We don't have the mass transit that New York does. We don't have the population that New York does. We have the luxury of being a rural state with a lot of wide open spaces. And I actually was able to work with like our school districts early on, and when I talked to the superintendents and they said, if we have all the kids wearing a mask in a classroom, then why do they have to quarantine for 14 days when, they should be with the layered mitigation steps that we've put in place? And so we were able to work with other states and to work with the epidemiologist team locally and really figure out a way to make that happen. And it was a game changer because there was just a constant churn with kids being in the classroom, out of the classroom, sitting out for 14 days, just impacted so much of what they were trying to do. So I think you need that flexibility to be able to make some of those decisions based on what you're seeing in your state. And we were all at different places, except for November. We saw pretty much a national surge, but all of us hit it at different times.
You appreciated that local control. At the same time, a lot of the legislation we're seeing out of the State House upstairs has to do with statewide policies, whether it be return to learn policies or curriculum things or things like that. Why not trust some of those Iowa leaders to make their own local decisions on things like that then?
So what I'm listening to is the parents, and I'll tell you some of the stories I heard were just heartbreaking. Almost the vast majority of our school districts did a great job and got the kids in the classroom safely and responsibly. And for parents that had children or a family member that had underlying conditions, we had an option for them to go 100% online, which was great. But for the parents that wanted their children in the classroom 5 days a week, that option wasn't there. And so I believe that, we hear a lot about local control. Well, I believe the very definition of local control is parental control. And this is what parents were asking for. They should have more say and a choice in their children's education. And that became very, very apparent over COVID-19. So, I think that is the definition of local control is parental control. And, I did listening sessions, multiple listening sessions with students. They were just pleading with me, let us go back to school. We're safer in school than I am out and about. I mean, we've got mitigation efforts in place. They're doing the sanitizing that they need to be doing. We're wearing a mask. That's where we want to be. Parents saying the same thing. You know the stories. You've heard the stories. And it's not just in Iowa. I mean, I can't imagine some of these states and some of these parents whose children have not been in a classroom for over a year. Just the social and emotional devastation that they're experiencing, not to mention the reduction just academically, how they're falling behind. And I don't know if some of those kids can even, will ever get caught up. It's unconscionable to me.
Talking about the schools, is 2.4% growth what needs to happen?
Yeah, I think I had presented 2.5 was in my budget, and then in additional, it's an increase in what they received last year. So. Yeah, I think that it is enough. But not only have we done the 2.5, you've got to take a look at everything. So, we passed the teacher leadership and compensation, which rolled into the formula. They're proposing per pupil and transportation equity. So that also goes a long way in helping address educating our students. And so, yeah, I think when you look at the whole package, it's a significant increase. I am proud. I want Iowans to know that when a lot of states were cutting their education budgets last year because of the fiscal health of our state, in the midst of a pandemic, we were able to add $100 million of new money to K-12 education. So we're not cutting education. We've added new funding every single year. And not only have we added new funding to the formula, but we've addressed inequities that have been talked about for a long time. And that, as I mentioned, that's per pupil and transportation. And then the other thing that we did too is passed, you extended SAVE for 20 years, which makes available about $26 billion over that timeline to help with some of the infrastructure.
Do schools need extra money to cope with COVID stuff in addition to that?
Well, they're getting it. So, you know, I think this last CARES 2.0 that came through, that's about $341 million that's available to school districts, and that's directly to school districts. That doesn't come through me. They received GEARS funding before that to help with some of the hot spots and some of the technology that they needed for, you know, the online learning. So, you know, there's a lot of money that's available to help with PPE, some of the disinfectant, some of the things that they need to do to help address what their costs have been in response to COVID-19. And I'm sure there's probably in the package that they're talking about right now, I would venture to guess that there's more money that's going to be coming into that will be made available for our school districts.
Up next, election laws in Iowa. Hear what the governor has to say about shortening the window for early voting.
At K-12, we're ready.
Welcome back to Close Up. The 2020 election, the future of the Republican Party, and will she run for re-election? KCCI's Eric Hansen's interview with Governor Reynolds continues.
Yep. Switching gears to the election, last year's election, more Iowans voted and made their voices heard than ever, 1.7 million. Secretary of State Paul Pate said that there has been no widespread election fraud in Iowa. What do you think about the measures going through the legislature right now about dialing some of those things back? As far as access to early voting, things like that.
First of all, we have one of the, I just so appreciate the election process in Iowa. It's fair, it's safe, and we're known for that. We get touted many times as a state to look at for the way that we conduct our elections, so we're proud of that. So, you know, I said it yesterday when I was asked at the press conference if I'd be willing to take a look at the amount of time that's allowed for absentee voting. I am willing to take a look at that. We've reduced it, I think, back in 2017. We had one of the longest timelines for Iowans to vote absentee. I think at that time it was around 40 days. So through compromise, they narrowed that down just a little bit more to where it's at now, and they're talking about reducing that again. So it was really designed to help people that weren't able. You know, it was never designed to be widespread. It was supposed to be narrow for people that weren't able to vote on election day. So, you know, I don't know what that number is, but I'm willing to take a look at it, and we'll see how. That's what the legislative process is for. So it gives Iowans the opportunity to weigh in and to make their voices heard, and we'll be watching closely.
As one of the leaders of the Republican Party here in Iowa, after the events of the last month or so, what's the future of the Republican Party?
Well, I'm excited to talk about what we're doing in our state. I mean, I think the policies that we've put in place are working. A year ago, we had an economy that was growing and robust. We had one of the lowest unemployment rates in the country. We were seeing our wages rise. And our fiscal health was strong. So we're going to continue, because of that, we're going to continue to invest in Iowans, and whether that's broadband or housing or daycare, or looking at supporting our education system. So I think, you know, Iowa is a great place to live, work, and raise a family. I think we stand out in the country, and I think the Republican-led states, the states that are led by Republican governors, they're going to come out of this COVID-19 recovery stronger and better, because we have been measured in our response. We have been consistent. And so I'm not the only state that's sitting on cash reserves and a surplus. Other red states are experiencing the same thing. So we're open, we're doing it responsibly, and I'm excited about the future, and we're going to continue to go out there and do big and bold things that help Iowans experience the opportunities that we believe are available here.
Is it a given that next year you want to run again, or are there times when you go, what did I get myself into? This is a tough job. This is a tough year for this job.
Well, it's been a tough year, but I got a great team, and I'm so blessed. Iowans are so resilient, and I tell you, at every turn, I have seen the best in Iowans, whether it's dealing with COVID-19 or a derecho or a drought or flooding along the Missouri, when just every aspect of the levees were impacted from the flooding. So we're great. We're lucky to be surrounded by such wonderful people. And so, you know, I'm not done. I've got a lot of stuff yet that we want to work on, that we want to see through, and so I'll make that decision later. But, you know, it's an honor.
We wrap up our conversation with the governor after this break.
We are KCCI.
Welcome back. We wrap up our conversation with the governor. KCCI's Eric Hansen asked about another big priority that she has.
On a personal note, a lot of people are wondering what to do when they get their vaccines. And I'm just wondering, you love your grandkids just like so many of us love our kids. Do you hug them? Do you have family gatherings? What? Because those are the types of things that people are wrestling with. What do I do in my family and how do I live my life and be safe? Tell me about your family and how you deal with it.
Well, you know, that's where I get my strength, is from my family. I have a very strong faith, and I have a very close family. I didn't see my mom and dad for several months because both of them have underlying conditions. And so we figured out a way to get together through Zoom like every other family did. I've been in church for a long time. I participate on Sundays via Zoom. So you adapt and you adjust. But yeah, I get together when we couldn't. I didn't. I wasn't going to be that person that says this is what you're supposed to do and then not follow through. So, but we're careful, we're responsible, but you bet I hug my grandchildren.
Now that your 100% in-person option is passed through the legislature and that's happening, what's your next top priority from the folks upstairs? What needs to be done at the top of your list?
So I'm really working hard for broadband. It is so important. We are not anywhere where we need to be, and I tell you, I think COVID really showed a light on that and just how important it is, especially in some of our rural communities. And so we need to, I've got a good plan in place, and we have the funding available to really leverage millions of dollars in private sector funding, and we can have the largest broadband build out in the country and go from one of the lowest to one of the highest. So that is really important and something I'm working on. But that in conjunction with, again, housing, that's a barrier to economic development. Child care, again, has always been an issue, and we've even lost ground over the pandemic. So that's how we keep a highly skilled workforce in place, is making sure that parents that want to work have child care options available that are quality and affordable. And then education will always be a priority of mine.
Thank you for joining us for KCCI 8 News Close Up. Remember to download our free KCCI mobile app to catch any past episodes of Close Up. We will see you back here next Sunday.